If you're over 65, stop for a moment and listen carefully, because what I'm about to tell you goes against what most people believe. Walking is good. Doctors agree on that. But walking alone is not enough to keep your body strong, stable, and independent as you age. And every surgeon, physical therapist, and mobility specialist knows this. If walking alone were enough, then older adults who walk every day would not struggle to stand up from a chair, would not feel weak climbing stairs, would not lose balance on uneven ground, and would not fear falling. But they do. Doctors see it every week. Men and women who walk faithfully, sometimes for years, yet their muscles continue to weaken, their balance declines, and their risk of falling increases year after year. The reason is simple. Walking mainly trains endurance, not strength. It uses only a small portion of the muscles that age the fastest after 65. Without targeted strengthening, muscle loss continues quietly, even in people who stay active. That's why today I want to show you 3 doctor-approved exercises that are better than walking alone for strength, balance, and independence after 65. These movements are gentle, joint-safe, and specifically chosen for older adults. No jumping, no heavy weights, no risky motions. Let's begin with the first and most important exercise. Exercise 1 is a chair sit to stand. This single movement is one of the strongest predictors of independence after 65. In fact, many doctors use it as a simple test. If a person can stand up from a chair without using their hands, it tells them a lot about leg strength, balance, and fall risk. Why is this movement so powerful? Because standing up from a chair activates the muscles that protect you as you age. The thighs, the hips, the glutes, the core, and the stabilizing muscles around knees all work together. Walking barely challenges these muscles, but the sit-to-stand trains them exactly how you use them in daily life. Here's how to do it. Sit on a sturdy chair with your feet about shoulder-width apart. Lean forward slightly. Push through your legs and stand up, then slowly lower yourself back down. Try to do this 8 to 12 times. Rest, then repeat for a second set. If you need to use your hands at first, that's perfectly fine. Over time, your legs will grow stronger and you'll rely on your hands less. Doctors trust this exercise because people who perform it well walk faster, climb stairs more easily, and experience fewer dangerous falls. It trains the exact motion you use when getting out of bed, standing from the toilet, or rising from a car seat. Walking does not train this pattern. Within weeks, standing up feels easier. Within months, daily life feels safer. Exercise 2 is heel raises, one of the most overlooked but powerful exercises for older adults. When people talk about leg strength, they focus on thighs and hips, but the calf muscles are critical for balance and stability. They help push you forward when you walk, stabilize your ankles, and prevent falls. After 65, calf muscles weaken faster than many other muscles, and walking does not strengthen them enough to stop this decline. That's why doctors often call the calves the second heart. They help pump blood upward and keep your lower body stable. To do heel raises, stand near a wall or chair for support. Slowly rise onto your toes as high as you comfortably can. Hold for 1 second, then lower yourself slowly. Do this 12 to 15 times for 2 or 3 sets. Walking only uses a small fraction of your calf strength. Heel raises activate nearly the full muscle. This builds ankle stability, improves balance, and reduces fall risk. Studies show that older adults who regularly strengthen their calves experience significantly fewer falls, especially on stairs and uneven surfaces. Over time, walking feels lighter and more controlled, not because you walk more, but because your muscles are stronger. Exercise 3 is marching knee lifts, a movement walking cannot replace. One of the biggest problems doctors see after 65 is weakness in the hip flexor muscles. These muscles lift your legs. They help you step into a car, climb stairs, step over curbs, and avoid tripping. When hip flexors weaken, people start shuffling their feet. They don't lift their legs high enough. They trip over small obstacles and lose confidence. Walking does very little to strengthen these muscles, which is why many daily walkers still struggle with stairs. To do marching knee lifts, stand near a chair or counter for balance. Slowly lift one knee as high as you comfortably can. Lower it with control. Switch legs. Repeat 10 to 15 times per side for 2 sets. This exercise retrains your nervous system to lift your feet higher and strengthens the muscles that protect your hips and spine. If it feels difficult at first, that's a sign these muscles have been neglected, not a sign that you're too weak. With consistency, confidence in your steps returns. So why are these 3 exercises better than walking alone? Because walking improves endurance, but these exercises build strength. Endurance helps you move longer. Strength helps you move safely. Walking supports your heart and lungs. Strength protects your independence. And after 65, independence matters more than speed or distance. Think of it this way. Walking keeps the engine running. Strength training reinforces the frame, the tires, and the brakes. You need both to function well. How often should you do these exercises? 3 to 4 days per week is enough. Move slowly. Focus on control. Rest when needed. Most people feel improvement within 2 weeks. Within 2 months, balance improves noticeably. Within 3 months, daily movement becomes easier and fear of falling decreases. Let me leave you with one important message. You are not too old. You are not too weak. And it is not too late. Research shows that muscles can grow stronger at any age, even in your 70s, 80s, and beyond. Your body is not failing you. It simply needs the right signals. Walking sends one signal. These 3 exercises send the missing ones. Practice them regularly, safely, and patiently. And step by step, you can rebuild strength, stability, and confidence in your body again.